I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
I'm Edward Ogden. There are, of course, many ways in which I wish the consensus statements were written differently, but I'll confine my remarks in the interest of limited time to one sentence on page 5. In the paragraph on schizophrenia, the second sentence as it's been written reads, ECT is generally more effective for those schizophrenic patients with a shorter duration of illness, more acute onset, and more intense affective symptoms. I think that this sentence, as it's been drafted, doesn't truly is incongruent with the evidence that was presented to your panel, and so I especially regret the endorsement of ECT for schizophrenia in this document. And I will explain why, and I'll suggest a way in which it might be improved. The people diagnosed with schizophrenia historically have suffered the most frequent and worst abuses of ECT. And I believe that the revival of ECT as a popular treatment for schizophrenia is one of the most likely outcomes of this document. And I think the panelists would not want to fear may occur. Now, the outcome research on depression, limited as it is a model of scientific rectitude compared to the outcome studies of ECT for schizophrenia. The reason for that is that modern scientific investigators, with very few, if any, exceptions, have not been doing outcome studies on schizophrenia. I suspect that this abandonment of outcome studies on schizophrenia has occurred because the modern investigators have concluded, as I have, that the older literature shows only the immediate organic brain syndrome, which of course suppresses the more bizarre and horrible symptoms of acute schizophrenia. And of course also the fact that the sudden onset, first episode of schizophrenia, has a good likelihood of improving with or without treatment. The evidence presented to you, the panel, at this conference was contained primarily in Dr. Small's slide, which was a slide that listed about half a dozen outcome studies on schizophrenia. I think if you would look into the references listed there, you would find, well, the one thing you would find the Exner and Murillo study, which was one of those. That was an intensive ECT study in which the patients were shocked repeatedly and frequently into a state of vegetation, where they were acute and persistent organic brain syndrome. Those investigators concluded that that status was an improvement over what they had seen before. I don't think that's what the panel would regard as real evidence of improvement in schizophrenia. And I believe if you would look at the other references there, you would find that it's impossible to tell from the other references whether there was any improvement in the patients, any different from what Exner and Murillo found.
Could we, I think one of the panel would like to respond to that, and I'd like to move on, if we could, to the next topic, because of the time.
I would like to suggest in conclusion, if I may, a way in which that sentence might be better written. If not entirely excised, which I think would be preferable. But if not entirely excised, I think it ought to be. The evidence is suggestive of an effectiveness only for those schizophrenia patients with a short duration of illness, acute onset, and intense affective symptoms. That would cure the tendency of the present wording to suggest that while it's most effective for some patients, it's also likely to be somewhat effective for others.
Thank you. Dr. Stone? Our intention clearly was not to have schizophrenia, have ECT be the first line treatment for schizophrenia. And we specifically state that in the first sentence. And we specifically state that it is not effective for chronic schizophrenia terms of the regressive shock that you described before, we again state that that is contraindicated. We stated it this way in order to have an opportunity for schizophrenic persons who did not respond to medication or could not get medication because of medical contraindications to give the practitioner some guidelines as to which schizophrenic persons might respond to ECT.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and might make copies available for the panel. We're talking about having at least accurate information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on a Thymatron pulse ECT device. And in there it shows the physical characteristics. The other, and pardon me for the emotional content of it, I also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. Now that's emotional. I don't really want to bring that up. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that's almost instantaneous entering the brain. This takes a half a second. Now that is just pure factor data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gum. Out with your gum.
Okay, this won't hurt. It'll be over in just a moment.
What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it.
oh,
That's right. Just bite down. Now bite down on it.
good. Are you ready?
Ready.